Spring training continues here in Surprise, Arizona, and we have been talking to a slew of medical professionals and the great training staff here with the Kansas City Royals and such. Dr. Key and Nick Kenney, head trainer and the head doctor here. Amazing relationship between you guys. How do you guys work together all season long to make sure these guys stay healthy?
I think it started, honestly, because this is my 10th season, from the beginning. It's just understanding our relationship. And Nick said it and I said it. So we talk to each other more than we talk to our wives at times. And it's just understanding that it's a comprehensive team approach and it's to the betterment of our athletes. And I have my role, Nick has his role, but we work together. And I think that's the big part, is understanding each other's role. I've learned a ton from Nick in my 10 years here. I'm sure Nick's probably learned some things from me as well. But it's just that close relationship that we have, all to the betterment of our athletes.
And Nick, what about you as far as working with Dr. Key and this staff here?
Well, I mean, obviously we value the partnership with KU Healthcare a great deal. You know, the big thing is that our relationship goes beyond work. So there's a friendship there, and when you can establish that type of relationship, you actually anticipate better for each other because you really know how each other ticks, and that's really important. The other thing is that, you know, the healthcare system itself is fantastic, but the people within it are even better than that. So that's why we enjoy it. And you know, when you've got people that are pulling for each other because they're in a team aspect and they really feel like they're team members, then it's amazing what you can get accomplished.
Nick, tell me a little bit about your day-to-day as far as what makes your jobs and responsibility different from Dr. Key's.
Well, it's because I'm on site with them all the time. You know, our staff here, myself, Kyle Turner, Chris DeLucia, Jeff Blum, and our strength staff, Brian Stoneberg and Louis Perez. I mean, we're here each and every day. We travel with these guys. We literally spend more time with these guys than we spend with our family when the season starts, and all the way up until it ends. So it's just, we know how they tick too. So when he sits there and says, well, I've learned a lot of things from Nick Kenney, well, it's because I've got more insider information than he does. And then he's taught me a lot of things that I can do to help, you know, establish relationships, get information, get them to the right person. You know, this guy has no ego, which I love. It's all just about the care of the athlete, and he's helped me foster that a lot.
Dr. Key, what's it like when you guys are working together? Do you get a call from Nick and say, hey, this guy needs to be looked at in a certain way? Or how does the chain of command work when an athlete needs a little special attention?
Well, I think it starts with the information that Nick gives me. I mean, whether he calls me, texts me, or what have you, or I'm at the stadium. And Nick is absolutely right. Nick deals with them on a daily basis. So a lot of times I defer to them sometimes in terms of things, because I'm just coming in at that snapshot, at that point in time where Nick and Jeff and KT and those guys are with them all the time. And Nick does a really good job. Nick is extremely thorough. And that helps tremendously, because I don't have to wonder about things. We bounce things out. We think alike, which is really good. There's some physicians that are just independent thinkers and they don't necessarily care what the trainer thinks. We're going to do what I say. I don't do that. I really defer to those guys. And so he'll tell me what's going on. He'll tell me the pertinent details. We'll go in and we'll talk first amongst ourselves, myself and Nick, and then we'll go in and talk to the athlete. And it's really important that we have to be on the same page with these athletes, because they're going to hear a lot of different things from a lot of different people, sometimes in terms of injury. Because they get injured, they're going to talk to their wives, or they're going to talk to their mothers, or they're going to talk to their agent, and whoever is in their sphere of folks. Well, they're going to get that part. And our part is to give them our perspective in terms of injury. And so we'll sit down and talk to the player, and then we formalize a plan. And then we execute that plan, whether that's me ordering something. Nick does a really good job in terms of using the healthcare system, in terms of getting them to the people in a timely manner. And then we come back together and then we interpret the data. And once we interpret the data, then we can formulate a game plan. And then we roll out that game plan. So it is very meticulous what we do with these athletes.
Nick, I've talked to several of the players. I talked to Dayton Moore as well this week about how there's such an open culture with the guys being able to come to the training room, because there's been a big myth in baseball years past. Oh, if you're in the training room, something's wrong with you and you need to be out there playing and not in the training room. How did you guys debunk that myth, and why is it such an open door policy with you guys?
Well, you know, it's kind of a vision over time. You know, that vision started, way back when I got out of college and got into professional hockey and started fostering it there, and then going to the Cincinnati Reds and tweaking it there, and having great people with the Cleveland Indians and tweaking it there. So it's like I'm just kind of like a grab bag of a lot of different people, you know, a lot of really good people that have touched my career, and I just felt like it was important to establish a culture, a space that people felt really comfortable in. One that they could tell the truth, tell us how they feel, because we really don't know how they feel. And if they can tell us sooner rather than later, then it kind of gives us options. We like to say that our space is more for prehab than rehab. If we're doing our prehab and doing the things that we can to try to stave it off, then when it happens, we accept it better. It's like, hey, we did what we could, and it happened. So now let's do what we got to do to fix it, rather than, man, I wish I would have. Maybe I could have. We don't do that, you know? So we're grinding for that stuff.
Grinding to make a championship culture and get this team back to the World Series. Thank you so much, guys. University of Kansas Health System is going to be very proud of the things that you guys have been doing all this time, and we certainly appreciate that. And once again, go Royals.